We just saw this patient a couple of weeks ago. This is very new to my office. He's a wonderful man. He came in to see me just about 2 weeks ago. He was having some pain on his upper right side, and the general dentist said, let's go ahead and retreat number 3 and go from there. And when I tested his teeth, he said, yeah, this area right here on this upper right side is having pain with on chewing and touching. So we went ahead and did clinical testings as far as palpation, percussion, bite testing, and it turned out that he was actually having more pain on number 4 than he had on number 3. By looking at the x-ray, you can tell that number 3 had a previous root canal, and you can tell that number 3 has periapical infection and radiolucency, and he was having some percussion sensitivity on number 3. But his pain was coming from number 4. I tested it and I showed it to him, and I said, well, you know, you need to have 2 root canals rather than 1. You need to have a retreat on number 3 and then a root canal number 4. And I told him, you know, let's go ahead and get started on this tooth. And he says, well, you know, I don't want to get started today, so I don't have to be numb twice. Let me go and come back on a different day, and we'll do both of them at the same time. I said, fine, that's okay. Let's go ahead and do that. So he came back a week later to do both teeth. And guess what? His tooth, number 4, cracked. He had the cracked tooth syndrome from before, and then he bit into something, he cracked it on the lingual cusp, about 4 millimeters sublingually. This is his tooth right here, and there's a crack right here, mesiodistally. You can see, you can pretty much move this. If you put your Explorer right in the middle, you can move his lingual cusp out. And when I numbed him up, I took the little lingual cusp piece out. I told him, I don't think we can save this tooth, and he was not happy that he had to lose a perfectly good tooth by cracking it sublingually, subgingivally, because he didn't want to get numb twice. So that was a sad case on his end, and it just turned out to be that way. But we actually told him, you know, probably needs to get an implant, so he's going to go back to his general dentist and get the implant done.
Should have listened to you.
Should have listened to me.
Why?